We had 9 cases, 1 from hotel quarantine, all but 1 case from an existing source, and Dr. Chant will give further detail on that. Can I say how incredibly proud I am that after March, when Minister Ayres and myself issued a call to arms to New South Wales businesses to support us during the pandemic, we've had 2 different groups of smart people, one university based in Sydney, another company based in Hunter, work together to provide the prototypes of these 2 great ventilators, which are going through the approval process and are nearly there for manufacturing. It's a really exciting time in New South Wales to know that even though we're going through a difficult time, companies and organisations are retooling, and it would be wonderful to know that New South Wales has the capacity to produce and manufacture its own ventilators for our surge capacity if need be, but also importantly to potentially export to countries in our region that don't have the capacity to do this. So it's a great opportunity for these 2 consortia who've been able to demonstrate their wares. I want to thank them personally and literally the hundreds of people that have supported their efforts in bringing these prototypes together. And please, again, renew to all businesses throughout the state. Don't be afraid to tell us if you want some help in retooling what you're doing. If you want to start a supply chain that may not exist in New South Wales, if you want to start manufacturing something we may not do, please let us know, and Minister Ayres will speak further about that. But in terms of the health application, obviously we already have top-notch ventilators in our system, but for the first time New South Wales will be able to manufacture and produce its own home-based ventilators, both for, as I said, surge capacity but also to export, and Minister Hazzard will speak further about that. In particular today, I wanted to emphasise not only the importance for all of us to be on our guard when it comes to the virus, but also to highlight, given some of the cases that we experienced this week, how absolutely contagious the virus is. Even if you are wearing a mask, you can still give the virus to somebody else, or you can get the virus. Please be careful about surfaces. Please be careful about what you're touching. So when Dr. Chant, the Minister and myself keep talking about masks being the 4th line of defence, we mean it. If you have a symptom, you have to stay home. If you go out of the house and isolate. If you go out of the house, you have to make sure you've got your 1.5 metre social distancing, but you also need to make sure you have good hand hygiene. And that means in particular being thoughtful about what you're touching and how you keep your hands clean whilst you're going about your daily business. And in particular, we know this impacts our businesses. I want to thank the thousands of businesses that have registered as COVID safe, that have their COVID safe plans. I got a good update today on compliance, getting up to around 75% of businesses having a plan, which is fantastic. But it also means that as patrons we need to be careful. If they don't have an electronic QR code, and hopefully all of them do because Service New South Wales is helping all the businesses have an electronic QR code, think about using your own pencil or your own pen. Now, I'm giving that specific degree of detail because technically you could get the virus by holding something someone else who's infected has held. So this is the level of detail all of us as patrons, as business owners have to think about to make sure we keep everybody COVID safe. And finally, before I hand over to Dr. Chant, I want to say that whilst I'm looking forward to having others outside New South Wales come to see what we're doing here in New South Wales about contact tracing and the like, contact tracing is only part of the story in dealing with a pandemic. Contact tracing, and our public health officials are amongst the best in the world, but contact tracing only works if you have the support mechanisms around that through integrated approach of all government agencies, whether it's compliance, whether it's Service New South Wales, whether it's police. Unless you have a whole of governance approach to managing the pandemic, the contact tracing isn't as effective. And I really want to make that point clear. Contact tracing is absolutely critical, and the fact that we've got a brilliant team is a large part of the story of our success, but it's not the only part of the story, and I really need to emphasise that, because if people assume that by only having good contact tracers you'll be able to deal with the pandemic, that won't do it. That doesn't cut it. And I feel that I've said it a few times, but it doesn't get reported. And I'm really keen to make this point, because I'm not suggesting we'll continue our successful path, because every day is a battle, and I wouldn't get complacent for a second, because that's not who we are as a government. But I can tell you our success to date is because of our integrated governance model here in New South Wales, and contact tracing is a key part of it, but it's not the only part of the story. If you only fix that, it won't necessarily mean you'll have a positive outcome. You have to fix a whole bunch of other things as well. Dr. Chan.
So there were 9 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,946. Of the 9 new cases to 8 p.m. last night, 1 is a returned overseas traveller in hotel quarantine. 7 are linked to a known case or cluster, and 1 case from southeastern Sydney has no source identified at this point, but investigations are ongoing. 1 case attended the Tattersall City Gym, and 1 is a household contact of a previously reported case linked to the CBD cluster, and both of these cases were isolating, and there's now a total of 68 cases linked to this CBD cluster. 5 of the locally acquired cases are linked to Concord Hospital, 2 healthcare workers, 1 patient, and 2 household contacts of the patient. The 2 healthcare workers worked at the hospital while potentially infectious, but reported having no symptoms whilst at work and wore personal protective equipment whilst caring for patients. Contact tracing is underway. So there have been 12 people associated with the Concord and Liverpool hospitals have now tested positive for COVID-19, including 8 healthcare workers. Investigation into the source of these infections are ongoing. Non-urgent surgery at Concord has been cancelled until Friday, and the hospital will be closed to all visitors. Can I stress that it's only visitors who were asking that it be closed to from 8 a.m. today on Wednesday, September 9th until 10 a.m. on Friday, September the 11th, to enable deep cleaning of all the wards, and it will also reduce the traffic flow through the hospital. Obviously, there will be exceptions, and if you have got a patient in that hospital and there are urgent reasons why you need to see your loved one, please raise that with the hospital, and there can be local circumstances can be managed. So following a boarding student at Kinkopul Rose Bay school testing positive for COVID-19, around 100 students have been identified as close contacts. Not all boarders as previously reported. All close contacts, including teachers and students, have been placed into quarantine, and the school has been cleaned, and the boarding facility remains open to some year groups. As a number of the boarding facility staff have been quarantined due to the fact that they were close contact with the case, there has been reduced capacity at the school to manage the boarders, and a number of the boarders have been advised to go home. That has been done in conjunction with the public health team in southeastern Sydney, and arrangements have been made on a case-by-case basis, and we acknowledge the support of the school. So cases attending the following venues whilst infectious are defined as close contacts, and our advice to the people that I'm going to mention in terms of these venues is to get tested and isolate yourself for 14 days regardless of that test result. Just to emphasise, the reason we're asking people to do this is we can pick up cases earlier if people present for testing, but it is essential that you then remain in isolation for the 14 days, even if you have achieved that negative test result when you've presented for testing. And obviously, if you develop symptoms at any time, we're asking you to get a test. The Albion Hotel, Parramatta Beer Garden and Pavilion on Saturday the 5th of September between 8:15 p.m. and 11:15 p.m. for at least an hour. The Crocodile Farm Hotel at Ashfield on Friday the 4th of September between 5:30 and 6:30 p.m. for at least an hour. The New Shanghai Night Restaurant at Ashfield on Friday the 4th of September between 6:30 p.m. to 8 p.m. for at least an hour. New South Wales Health is also directly contacting patrons identified as close contacts at these venues. And as I said, patrons who are there for less than an hour at these times are considered casual contacts and must therefore monitor for symptoms and follow the advice provided. Anyone who attended the following venues or travelled on these trains at the following dates and times are considered casual contacts and must monitor for symptoms and get tested immediately if they develop. And after testing, they must remain in isolation until a negative test result. So these people don't need to stay in for that 14 days. We're just asking them to, if they develop symptoms, to get tested and remain in isolation whilst you're waiting those test results. That's the Macquarie Shopping Centre, including the food court, Cocoa Tea, Maya Time Zone and Tommy's Guns Barbershop on Saturday the 5th of September between 2 to 5 p.m. The Railway Hotel, Liverpool, on Friday the 4th of September from 10 p.m. to 11:30 p.m. The T1, T9 North Shore Line on the 7th of September between 9:17 to 9:29 a.m. from Milson Point to St Leonards. And the T1 to T9 North Shore Line on the 7th of September between 9:53 to 10:14 a.m. from St Leonards to Milson Point. Can I continue to urge the community to come forward for testing, and particularly we are urging high testing rates in those areas of southeastern Sydney, the CBD and northern Sydney areas, as we've announced a number of venues in those areas, and we do want to make sure that we haven't that there haven't been undetected chains of transmission. So thank you very much for the community for coming forward for testing. It's pleasing to see that we're still maintaining those high testing numbers, and that is to a large extent the success that we've had to date, but it does rely on all of you to continue to come forward for testing. Thank you.